Hey everyone, it's Troy Jackson with this week's weekly update. So last week we actually presented a bill for facility fees. Now, this is when a hospital charges you an additional cost on a procedure that you had to try and make up some costs for something else. And people get really quite shocked by having this exorbitant price on top of your procedure costs.
I saw a physician assistant who ordered x-rays that were immediately performed across the hall inside the walk-in clinic. The subsequent bill I received that included a facility fee associated with the interaction with the physician assistant and another identical facility fee associated with the x-rays.
We're trying to stop that because obviously it's not fair. For one, it's not part of what you actually went in the hospital for, but the biggest thing about it is that you don't ever know about it until afterwards. So you can't ever negotiate. You can't ever say, well, no, I'm going to go somewhere else if you're going to charge that, because it comes after you've had the operation or anything like that. And so the bill that we put in is going to try and at minimum make it transparent so you know ahead of time going in, and hopefully at best get rid of them or reduce these facility fees. So another bill that we heard last week was Senator Cameron Reny's bill on referencing of drugs.
I am Cameron Reny. I represent Senate District 13, which is most of Lincoln County, as well as the towns of Washington and Windsor. Lowering the cost of prescription drugs is very important to people all across the state, including my district. I think it's easy to say that healthcare should not be breaking the bank for people. It shouldn't be making people go into debt. These medications aren't something that you get for fun. These are things that people need to be able to live good lives and healthy lives, and they should be affordable. LD 1829 would tie the price of prescription medications to the price that Medicare would pay. So because of the Inflation Reduction Act, the IRA of 2022, on the federal level, Medicare is finally allowed to negotiate with pharmaceutical companies to get cheaper drug prices. This just ties that same price to what all other insurance carriers in the state of Maine would be able to purchase for and sell for. It has the potential to pass down a lot of savings to consumers, to our friends and to our neighbors who desperately need these medications. This seems like a simple concept, but it will require us to be brave, because when you cut into pharmaceutical company profits, they're not going to like it. And we have to be able to stand up to that, because we deserve to have healthcare that we can afford.
So in addition, I actually presented two bills on the logging industry. One of them was actually a bill to try and have the Department of Forestry send their forest rangers out and actually do spot scales on wood that's been sitting there for a long time. Now, anyone that works in the logging industry knows that unfortunately in the summertime, when your wood sits there for months on end, it dries and you lose weight, and if you lose weight, then you lose price on when the wood's actually hauled in. And way back in my time, that was happening. Last summer, I'm sure because of the high cost of fuel, I had a lot of people called, asked me what they could do about that their wood was sitting, it was drying, they couldn't get paid, they had big fuel bills, and the department wasn't responsive to that time. So this seems to be, like I said, a law that's already on the books, 15-day rule, but this is actually the enforcement arm, going out and actually making it happen, so that people don't have to call and put themselves, in the bullseye of the large landowners. There's just no reason why logging contractors are the ones that actually have to bear the brunt of that. If the landowners want it to sit, then they should be the ones that have to lose, the weight on it. And that's this week's weekly update. Look forward to seeing you next week. Take care and be well out there.